rising to the challenge, the innovative strategies for mobilizing K-12 schools as COVID-19 vaccination sites. We've heard a little bit about this already. You've seen some resources or have links to resources, but I'm pleased to be moderating this discussion to have some opportunities to directly share experiences with mobilizing schools as COVID-19 vaccination sites. We're very aware of how different each school district is in the United States and the special circumstances that presents. As we talked about in our recent issue brief, there are a lot of approaches that have been used to host vaccination clinics, some using health centers, some using other partners. Mary talked about pharmacies and other approaches as well. There's not a one-size-fits-all approach. You're going to hear about some different approaches and the logistical issues involved and how to overcome them from our panelists who have all been working hard to support COVID-19 vaccination clinics in their own states and communities. We've asked them to give about 5 minutes of opening comments about how they've operationalized these efforts, worked through the challenges, what they've learned, and then we're going to have some time for discussion. Please send along any Q&As or comments that you have. Our panelists include Tiffany Tate, Executive Director of the Maryland Partnership for Prevention, Sarah Regal, who's Health Services Administrator for School-Based Partnerships and Child Care Health, and Caitlin Miller, Program Manager for COVID-19 Program for Public Health in Seattle and King County. They'll be presenting together, and Gabriella Blakey, who's Chief Operations Officer of Albuquerque Public Schools. Again, thank you all for your taking time today, and I'd like to first turn to Tiffany to talk about the Partnership for Prevention's work with schools in Maryland. And Tiffany, I think you're on mute still.
Great, thank you so much. Good afternoon and good morning to some of you. It's really nice to see you and to be here to talk about something that we've been involved in for quite some time. We can go to the next slide. I'd like to talk about sustainable programming in school-located clinics. So just a little bit about our organization. We're the Maryland nonprofit, the Maryland Partnership for Prevention. We're a nonprofit and we've been around since 1999 as an immunization coalition for adult and childhood immunizations. Historically, we provided technical support and training and educational opportunities for immunization stakeholders. And about 7 years ago, we got into the business of providing school-located vaccinations. And initially we started in response to health departments' need to have support to administer flu vaccinations in schools. And we quickly learned that our model also applied to other vaccinations. And so we administer about 30 to 50,000 vaccinations a year to children and to staff and faculty in schools. We also administer vaccinations in long-term care settings, churches, employers, and other community settings. And we also are a distributor of vaccine technology and testing technology that supports our work. Next slide, please. So what we do is just go into the schools. We have strong partnerships with the schools and the school leaderships. None of this could work if you did not have strong partnerships. And so partnerships are more than just writing your name on a paper and signing off on something and having your name posted on a website. It's true partners where all of the roles and responsibilities are defined. And so we have clearly defined roles for all of the folks that you see, or the entities that you see listed here. And that's how we're able to sustain our programming, by having substantive partnerships where everyone knows what their roles are and are committed to that. Local health departments are involved, the state health department's involved, local coalitions, parent organizations, and also the general community. You can go to the next slide, please. So this year, what we're planning to do is just offer COVID vaccinations and flu vaccinations together. And so historically, during flu season, we go in, we vaccinate 5,000 students a day. We have a number of teams that we deploy, and they go into dozens of schools. We vaccinate students, and we just go back every day until everybody's taken care of. And this year we'll be administering COVID vaccinations at the same time as flu. In the springtime, we offer what we call back to school vaccinations. So we offer Tdap and meningococcal and HPV vaccines in middle schools. And so at that time, we'll also be offering COVID vaccination. So our approach is just to use our existing model to offer vaccines to bring children up to speed, up to date on their general vaccinations, and also offering COVID vaccinations and flu vaccinations when it makes sense. But in order to make this work, you also need buy-in from the community. So providing education to let people know why vaccinations are important, that children have fallen behind because of COVID and other reasons, and that it's really important to be vaccinated, and that it's okay to have these vaccinations at the same time if you're offering more than one type of vaccine in a clinic, to market your activities and also to provide other resources to support that. It's also really important to have a skilled clinical team. When you're offering multiple types of vaccine, if you're offering these back to school vaccinations at the same time that you're offering COVID vaccine, you need to make sure that your team understands how to administer the vaccine, how to mix the vaccine, how to make sure you're not administering vaccine to the wrong person. One family might have approved for their child to get back to school vaccinations, but not COVID, or vice versa. So we need to make sure that that's taken care of. And so there's a lot of training and logistical things that are involved in being able to pull off these types of partnerships, and also having general clerical support to move things along. The next slide, please. The other things that make this work is technology and automation. So about 4 or 5 years ago, we came up with a product that automated the consent form and also the clinical management. So tracking inventory, documenting the vaccine encounter, and reporting that information. And we saw a 50% increase in participation when we moved to this model where people could fill out the form online. And so we've seen it increasingly during the COVID, that people are more savvy with technology and expecting technology. And so to be able to make this work and remove the administrative burden of data entry and photocopying a bunch of papers and forms and getting them out and collecting them, instead you can do this electronically. And we created a system for our own personal use about 5 years ago, and now it's being used during the pandemic. It's called PrepMod. Some of you may have heard of it, but our PrepMod system can also be used for school-located vaccinations. It can be used for flu vaccinations or combination clinics. So it's really important to have technology and use that and leverage that where you can. We also have a system called PM Schools that allows you to schools to schedule these types of clinics, and also it tracks staffing and does timekeeping. And so these administrative activities are really burdensome when we're thinking about having school-located clinics. And so we've created technology that automates that and makes that easy. That is something that deters people from having these types of campaigns. Finally, reimbursement. So now there's a lot of money flowing to be able to fund these types of activities, but we're always thinking about sustainability. And so you need to have a mechanism to be able to collect insurance information and to bill insurance information. And out of need, we also created a tool. And so this suite of services that we've been using, we make available to others. But in order to have sustainable, successful campaigns, you have to be able to automate things and make it easier for people, and also identifying ways that you can keep these going, because it threatens the confidence that the community has in public health if we start things when the money is flowing and then it goes away afterwards. So I think that's the end of my comments, and I'll be happy to participate in answering questions when the panel starts. Thank you.
Tiffany, thank you very much. And I'd like to turn next to Sarah and Caitlin from Seattle and King County to talk about their school-based vaccination efforts. Thank you all. And be sure to unmute.
Sarah and I are playing a game of chicken right now. Who's going to talk first? And I'm going to make Sarah.
No, I'll go ahead. Thank you. And luckily, Caitlin and I are two people who talk really quickly. So they may be for the benefit of getting back on track. But we have a lot to share. And what I'm going to do is frame a little bit of the context at our health department and sort of how we got started with our vaccine work for schools, and the history that's important to, I think, part of the successes that we've had is really about the relationships that we have with school partners across our region. We are the largest county in our state. We have 19 school districts and 216 independent schools in K-12. So we're pretty large. Our largest district, Seattle Public Schools, has 55,000 students. So across our state, we've been leading this work. Public Health Seattle and King County created our school-based partnerships program, which I lead. And prior to the pandemic, we have 35 school-based health centers that we support. Also a childcare health consultation program that's part of my work. And so it was pretty natural that at the beginning of the pandemic, I stepped into a key role to support schools with the immediate implementation of their mitigation strategies, especially childcare and schools while they remained open, while we became an epicenter very early on in the pandemic process. So we established that task force in February of 2020. And right around that time when schools closed, we played a key role in supporting the implementation of those mitigation strategies, writing guidance where those things didn't exist, where we had CDC on the ground with us in those very, very early times. I pulled Caitlin into that work as well, and we created a multidisciplinary team that was our task force. Our school-based health centers, like I said, 35 of them, really only closed their doors for a short period of time in the spring of 2020, and all reopened early in the summer of after that, and remained open during the time where schools were closed. So they were really the only access points and the only school partner that were allowed inside buildings during the largest portion of our shutdown. And they were able to continue to provide services for students, really focusing so much primarily on routine immunizations, meeting students in the park, outside, often going to students' homes, and just wherever people were comfortable, using, again, the established relationships that they had with families and as their primary care providers to support the continuation of routine care. And then as vaccine became the primary mitigation strategy for staff, when our teachers became eligible for vaccine around April, I think, end of March or April, we pivoted a bit more to linking with our vaccine team, who was already doing some of this work for adults. Caitlin moved to a full-time position on the vaccine program, so we continued to use our task force as sort of this hub and spoke model where schools have really a one-stop shop and no wrong door to access all sorts of information about the resources that they needed to support their schools and communities. And so vaccine just sort of became a natural next step in terms of our strategic approach to supporting schools across the pandemic. I'll shift to Caitlin now to talk a little bit about what that vaccine work looked like, and then also look forward to questions later.
Thanks, Sarah. The schools and childcare task force that Sarah is mentioning right now, as she said, is a really critical core to our work, and vaccine has become a major offshoot of that. And when we were aware that vaccine was going to become available and that likely school staff, childcare staff were going to be prioritized in the rollout, we really started to pave the path early and ask for schools to identify whether they would be willing to host school located vaccination clinics when the time arose. So by the time that effort came to fruition, we already knew who to talk to, where we could go, what their capacity was, and it helped us mobilize our vaccinating partners to get clinics up and running right away. So I believe at the time, I can't even remember the date at this point, when people 12 and older became eligible for the vaccine, we didn't have a lot of time left in the school year here in our region to really make this happen. And so within a week, we had events already popping up. We are working with a lot of pharmacy partners, with our EMS, emergency medical providers, our fire departments, and continue this partnership now into the fall. We were really, really grateful for that partnership to have over 110 clinics pop up in the spring in our 19 school districts here in King County, serving about 15,000 students with first dose vaccines. And many of these were open to families as well as community members as well. This summer, we've really focused on other youth-focused events in the community, reaching people where they are, catching them up with routine vaccines as well as COVID, making sure that we have partners that can do both our vaccines for children, administered vaccines, as well as COVID vaccine, and building capacity, as Mary mentioned earlier, of really having teens and young people talk to their peers about why it's important to get vaccinated, not just for COVID, but for other vaccines as well. We're also working on a really robust pediatric referral system, making sure folks have a place in the community to go to for routine care, well child checks, as well as COVID, supporting our vaccines for children providers to ensure that they can also provide COVID vaccine. And now in the fall, we're really focusing on catch-up events. What we paved the way for in the spring is continuing into the fall and making sure that we have at least a few events in many of our districts where the needs are highest. For both COVID and flu co-administration. And we're prepping for the EUA. As was also mentioned earlier, we're really trying to do what I call the pre-work and making sure that families have opportunities to learn and ask questions in the lead up to any clinical services provided on campus. Because we know it's not just about having the clinical service there, it's about having the conversation and the confidence to really move forward with making that decision for your family. I will end there and pass it on to our next panelist.
Great. Thank you both very much for that concise dual presentation on the Seattle-King County experience. And next, I'd like to turn to Gabriella to talk about the Albuquerque Public Schools COVID vaccination efforts. And Gabriella, I'm on mute too.
Thank you, and thank you, everybody. This presentation, from my perspective, is actually looking from the school district's perspective of partnerships with COVID vaccines. Our school district is about 75,000 students and 143 school sites. And I have to say, I'm really proud to be a part of New Mexico, where I think that as a state, we quickly moved forward with COVID safe practices and getting immunizations out in a very effective way in a state that could have turned a different way if we didn't have all of these partnerships and the leadership of the state. Next slide. So as a district, we use the guiding principles and values in moving forward with COVID vaccines, looking at access, trust, and community. And I think this has been talked about over the course of the morning, but really in effect in Albuquerque Public Schools, we looked at access as far as increasing access to vaccinations to our community. We have a very diverse community that is rural and urban, and a lot of poverty in our state as well. And so looking at access was really important for us in our community. Trust, we looked at as one of our guiding principles, because as a school system, we often have trust in our families as far as using the facilities and communication that's trusted between the school site and our families, that we were able to really leverage to bring families in to get vaccinated by using our facilities and communication through the school district. And overall community, I think, as everybody has spoken about, without our community partners, we really wouldn't have been able to respond to this public health crisis as a united front. And honestly, for my role as a chief operations officer, it was really kind of moving some red tape out of the way to give access to our families and to the community to be able to use our facilities and to increase our vaccinations. Next slide. So what did we do? We worked to distribute about 40,000 vaccines for our community within the Albuquerque Public Schools facility sites. That's just a fraction of what our state was able to do. We contributed to the 8th highest vaccination rate in the county, in the country, with our county, specifically of Bernalillo County, where Albuquerque is located. We're about 72% fully vaccinated. We had 10 sites within our schools that we opened, and we also opened up our stadiums for drive-through clinics as well. We worked to, we have about 12,000 employees, and so we facilitated access for making sure our employees were vaccinated prior to our reopening of school in spring of last year. And then we had about 37,000 eligible students that we facilitated getting them appointments and making sure they were vaccinated. We also had a really good, and we continue to have a great portal through our Department of Health as a state. And what we were able to do is really leverage the use of the portal with our families, our students, our staff, to publicize the use of the portal and making sure that it was communicated so that everybody had access to get registered and to get vaccines. Next slide. So this really started in December of 2020, and we looked at a partnership with our city, the Emergency Response Department, and the New Mexico Department of Health. Our school facilities were closed because we were in remote learning, which had an opportunity to be able to open large sites for vaccines because we didn't have them open for schools. So in this first phase, we looked at weekly vaccination hubs, and we opened 4 high school sites. They were our largest facilities, obviously, that most people were familiar with how to get there. And we opened them up for vaccinations for the community. At that time was phase 1 for New Mexico. And then our school nurses, since we were in remote learning, they were able to come in and assist with the distribution, which really helped increase the effectiveness of our Department of Health to get vaccines out with an increase in the number of people that could help. We used our maintenance and operations department to set up all of the vaccination sites, as well as provide cleaning during this time. And then we used our school police to assist in all the traffic control. Next slide. This is just an example of one of the sites we used, our professional development site, as a vaccine distribution site for the city. And we just kept it open because at this time it was kind of something positive we could use by our facilities being closed and not being able to bring groups together, as we have a fabulous professional development site that was closed for conferences, but we quickly opened it and just kept it open as a vaccine distribution site that was used over the course of the past few months. Next slide. Phase 2, we moved into in about March. Again, phase 1, we started in December. And this was when our employees were eligible for the vaccine. And so because we had these partnerships and we had already been doing these sites, it was really easy to quickly adapt to the next phase of our employees being able to get appointments and teaching them how to use the portal from the state and making sure that they're getting their vaccines, making their appointments and everything. And we used several partners throughout the city that we used as vaccine providers and made sure that all of our employees were vaccinated by the end of March. Next slide. And then our last phase 3, which we kind of continued to be in, was including students age 16 and above for vaccinations. We prioritized our seniors so that they could be vaccinated before they graduated. And then we phased in students 12 and above as the vaccine was approved. And then this also led to working with the Department of Health to open up our schools for the Back to School Got Shots clinics that they provide for students for all the adolescent vaccines. And since we had this kind of already going, it was really easy to be able to adapt our schools to provide all of the back to school vaccinations and help our students catch up with their vaccines. Next slide. And just real quickly, the lessons that we learned through this and that we continue to learn as we work to keep providing vaccines to our community is trusted facilities of our schools being opened up, and communication led to building vaccine confidence across our families. Partnerships were essential. You know, we're the school district. We relied on our Department of Health and all of the community partners with a common goal of just getting our community vaccinated, and having that partnership was really important. And using each partner's expertise was important, that we all had this shared goal, but all of us brought something different to the table. And we just leveraged the expertise of each of the partners to quickly adapt and get the vaccines out. Again, this led to us opening our schools very quickly for the Got Shots clinics from the Department of Health, and also increase the distribution of flu vaccinations, which we're in now. And everybody just keeps asking us, okay, so when do we do flu vaccinations? And now we're able to really build up that vaccine confidence and get our community healthy. And that is it for mine.
Great, Gabriella, thanks for, and all of you for some very informative, packed presentations. We do have some time for discussion of these experiences now, and making sure that we're addressing questions or concerns that you all may have, things that you'd like to follow up on. Again, please use that Q&A function to put in any question, add comments, or otherwise enrich this excellent discussion. But let me start, if you all don't mind coming back on camera. In all of you highlighted the need for a collaborative approach to implement these programs effectively. Obviously, schools involved, public health involved, pharmacies or other healthcare providers involved. Could we talk a little bit more about the community partners? All of you mentioned those, but that's a potentially very diverse set of assistance with connecting with people, getting trust and engagement out there in the community. And I wonder if each of you might have a few words about particular community partnerships or approaches to engaging the community that have been really effective in your work. Gabrielle, I see you on screen, if you don't mind.
Sure. In Albuquerque, particularly, we have a robust set of community schools in our schools. And so we really leveraged partnerships with our community school coordinators to get out to the community that they serve information, let them know when the clinics were, bring them to the clinics. And we, worked to translate into, I think, 27 different languages, flyers, the permission slips, everything we needed. And so we really worked to leverage the partnerships that we already have established through mostly our community schools partnerships.
Thanks. Others want to comment?
I would add the same, all the things that we've mentioned, the existing relationships, I think were very much key to starting up all of the work we've been doing with schools, but building more that didn't exist, and also utilizing other community-based organizations and other resources that I think emerged in the COVID response more broadly. In our emergency response system, we set up a community mitigation branch, which is now Community Mitigation and Recovery. And when that group formed, it also had really other sector-specific task forces and community-based task forces. So, for example, Latinx community or faith-based organizations or other places that, although school is a natural place, it is not always the first place. And especially during this time, it wasn't the place that some families felt was safe, or that school was not necessarily a trusted community. So we used other trusted messengers and other community folks to draw people back towards school as a centralized location, because physically and geographically, school seems to meet a lot of people's needs, but it may not have been the first place that people thought to get information or vaccines from.
Thank you. Tiffany, anything you'd like to add?
I would like to add that when you explore these community partnerships, one of the most important things that we found is having the partner responsibilities delineated and written out. So we have a document, a 2-page document that lists what the school health department, what the school health group will do, what the health department will do, what the parent teacher association. It's sometimes we assume that everyone knows what their role is, but sometimes they don't. So when you engage in these partnerships, particularly when you're having such a logistical rich initiative, that you need to make sure that everyone's very clear on what they're doing.
Great. So thanks for those additional insights. We've talked a lot about your experiences so far, which no question have been challenging with the midst of the pandemic and the new developments related to COVID vaccines for adolescents. I'm wondering if we could spend a few more minutes looking ahead. So coming soon, the next month, are potentially the authorization of the first vaccines for children aged 5 to 11. Wonder if you all could each comment on how you're planning for that. Is it going to be different in some ways from what you've done so far? What are the new considerations?
I'll start with, we have already a very robust existing program where we go into the schools and administer flu vaccinations in the fall and back to school vaccinations in the spring. So we've got all of that already laid out, and we just intend to add COVID vaccinations. And because this is a new thing for us, we'll be refining our process as we go along. So we're excited and nervous at the same time about how this will work to offer COVID vaccine in the clinic, and how do we identify who's signed up for what. But if you already have an existing infrastructure, it will be interesting and informative to see how you add COVID to the mix of vaccines.
We've started to look at it and be ready for our younger students. I like earlier the slogan, I guess, of the students in, COVID out, that I think would be helpful in us as we look at our younger students. And ours is a little bit different because we used hubs basically as central locations around the city. And looking at our younger students, we're seeing more of a need to go to the school. Like Tiffany was saying, to actually go on the site to give the vaccines for the younger students, and knowing that most of them, if it's similar to what we've done with the flu vaccine, they need their parents to be with them. And usually we need to do them at the end of the day. so that the other students don't freak out when they see younger students crying. So just because of the age group, it's just a different age group than trying to get our 16-year-olds in. So I think that ours is adapting a little bit more to smaller number of students and going in. Again, we have over 90 elementary schools. So looking at how we can facilitate that is something that we're starting to look at.
Thanks. Caitlin?
It's kind of an inverse situation for us here in the Seattle-King County area. Similarly, we have many, many more elementary schools than we do middle and high schools. The challenge is they're very small. And right now, as we see the EUA coming up, the potential for boosters, third shots going on, and a very, very strapped medical system here locally, we're having to figure out a more hub-based model. Whereas before in the spring, we had the capacity to really be in many, many high schools and middle schools. Consent is definitely an issue here. It's changing our timing. While we could have and rely on older students to bring consent forms or be a little bit more tech savvy to do online consent or phone-based consent with their families, we don't have the same resources and opportunity for our younger students. And so it is, as Gabriella mentioned, we're looking at events later in the day, on weekends, that could really draw people regionally to sites. But it's hard to say, and it's going to depend district to district, because at least in our region, we have vaccination rates for our adolescents right now ranging from 54% to over 95% between our 12 to 19-year-olds. And so really trying to focus with an equity-based lens on where we drive these resources that are continuing to get more and more strapped as Delta makes its way through. But it's definitely shifting our approach for sure, working with our younger groups.
That's very helpful. Thanks. Looking through that, we got a number of good questions, and thank you all for submitting. None of them relate to kind of picking up on what's different from doing school-based vaccines clinics in this context versus in the pre-pandemic context. So one of them is about, well, people are resistant, not only now but before, because this is an added logistical burden. I think you may have mentioned kids, Gabriella, maybe kids crying during the day, and that's disruptive too. What have you found helps? Are there issues that are different now, and what do you find helps people overcome the reluctance, maybe engaging and getting these clinics in place?
I think part of ours is, we do have our, public health order and how we navigate students who are positive, like close contacts. If they're vaccinated, they can stay in school. So we look at some of that as far as like prioritizing in-person learning and what families can do to keep their students, safe and be able to maintain in-person learning. So as a people back, we also look at events, because then it's, something positive. We find that most parents that are not necessarily wanting to get the vaccine, then those are the students that aren't getting the vaccine. So we're trying to look at how we can do positive family events as well. We're doing one pending the approval for our younger students at the zoo, where they would be able to go in and go to the zoo for free. It's also a distraction from the little ones after they get their shot. But looking at like positive ways, keep pushing hesitancy and building up confidence for the little ones and their families.
Any other comments on this one? What's different now?
Well, I think there's a lot that's different. One of the things that we're excited about is that the schools have had to be so flexible, and they already have been experts in making decisions on the fly just because of the nature of their industry. But now we're looking to them to figure out the most appropriate ways to educate families, to reach out to families, to secure consent. The schools have had to evolve their processes with the pandemic. And so while we've been in the thick of it in terms of helping with vaccinations, the logistic critical concerns that people think about, and just how do we relate to families, how do we educate them, we can rely on the systems that have been evolving during the pandemic that the schools have been relying on. So we've always viewed them as a really strong partner, and now even a greater resource. And I encourage folks who are looking to work with the schools to rely on them to answer some of these questions, because we can guess and make the wrong decision and end up wasting time. I just go to the schools and say, what are you guys doing? What do you think and what's working?
Thank you. Caitlin, Sarah, anything else to add?
I would echo
Other
what
than,
Tiffany just mentioned. Yeah, it's just, I think really letting the districts drive and dictate what the needs are in their communities, principals, other leaders, parent-teacher associations, and others, and really helping that define and guide the work that's happening in these SLV clinics. And not as the health department coming in and saying, thou shalt do these things, or we expect you will do this. They really are in the driver's seat and are working in tandem as peers to their vaccinating partners. Safeway, Costco are our two big ones, and others. That is really what makes this tailored, and focusing also on what I call this pre-work, which is those conversations in those spaces that are trusted and known in those communities, and having that be a bulk of the work, a focus of the work beyond just the clinical service.
Yeah,
I was just going to add too that this is the first time we're able to say yes to a lot of the requests that have. So historically, we haven't provided a lot of school-based vaccine clinics, at least from the health department's perspective. We're doing it in our school-based health centers. We're doing, some districts are doing sort of contracted support just for flu. And they consistently ask us for decades, why won't you come to our school and do all the Tdap? And we just haven't had the capacity to do it. So for the first time, we say yes, and we're able to link lots of vaccine partners together and make it possible. And, you know, I hope it's something that we can continue to sustain and learn from for the future as well.
Yeah, if we have time, it'd be good to hear from you all about how you're planning to sustain all of this, or what might be helpful in enabling you to sustain these new efforts. I did want to pull together a few more questions from a great set that we have that are in one way or another related to equity issues. Now, you all have touched on this and the importance of community outreach and trust, and some steps that you've taken to do that. Maybe if you don't mind, can you expand a little bit on that? Any steps that you're taking to track vaccination in ways that address equity and respond, or other indicators that you're using suggesting that more outreach efforts may be needed? Gabrielle, I saw you got a call out for some of the work you're doing with Indian Health Service in the Albuquerque area. But any thoughts about additional guidance on addressing these kinds of equity concerns?
Yeah, I would say, one of the things our health department has excelled at extremely well in this last year. First off, our director declared racism as a public health crisis very early in this pandemic period. And we've continued to sort of live that through our emergency response and our community mitigation branch, especially in our strategies around all sorts of implementation of the pandemic efforts. So with that, it's really, as Caitlin alluded to, looking at our county, which is geographically pretty large and also quite diverse. So as she said, the rates of vaccine and even the rates of COVID and all sorts of things are really following the demographics in our community, where the southern part of our county has the greatest number of disparities. And then to the north and east, we tend to have more homogeneous populations with higher rates of vaccine and lower rates of COVID. And so we are looking deeply at the data in order to figure out exactly where we should be focusing our efforts. Now, for school districts, we're doing the same, but also making sure that our resources are, well allocated, that are not always focused in our city, which tends to get the greatest attention for the majority of the population in our community. But making sure that we're reaching all parts of our county. We have a large city. We also have some very rural areas to the east as well that have different political viewpoints, and really just trying to manage all that diversity in an equitable way. Caitlin posted a link to our vaccine dashboard, which I think is kind of exciting. I love a good set of data and some Tableau that lets you manipulate that. So for us, that's really useful. And for community, that's useful so that they can really see what's happening in real time in their local area by geography, by zip code, and with other demographics in mind as well.
Ours is very similar in that we really we partner with Indian Health to make sure that we can effectively reach out to our Native American community. Again, with like a trusted community partner that could provide vaccines. We have a large immigrant population. Using schools is a very successful with some of our families that have fear of going to the doctor or anywhere that they feel like immigration could be an issue, and so, or that they have to fill out a form with information they're not comfortable with. So using our school sites for that population is really effective. We also made sure that primarily the location, that we were very strategic in picking which schools we would have the vaccinations, so that we can make sure we're addressing students that would be less likely to go to, a primary care, or to be able to feel comfortable walking into a pharmacy to get a vaccine. So we were pretty strategic in the locations of our vaccination events. And overall, it's really, right now, I don't feel like our community is as inequitable in the vaccine distribution. Right now, most of the pushback we get is from a very different community that doesn't want to get the vaccine, whereas I think we've been able to address some of the inequities in a very strategic way as a state.
I'd add a few other things that we're really focusing in Seattle and King County on a very multimodal approach, where school located vaccination is a supplement to other systems and networks. We have community vaccination events that are located at faith-based organizations, that are at community centers, that are at Seattle Housing Authority, King County Housing Authority, other places where people gather and meet. And we are working with, as Sarah mentioned, many folks in our community mitigation recovery branch. We have a team of community navigators that speak a variety of languages, that are from a variety of different communities, and are actively in community, not necessarily as public health or county officials, but as partners, and being there and understanding what the needs are so that we can be responsive to that. We have a universal approach, wanting to make sure that as more people become eligible, we are making sure that access is available to everyone, but really dialing in and not going away. As a health department, we have a history of perpetuating racism, perpetuating a lot of inequities, because we go in, we do what we think we need to do, and then we leave. And in this response, I've been really proud of the work that our whole broad team has done, in that we're not leaving. We are here and we are supporting communities as they make their decisions, knowing that is not a binary thing. It's usually a process. And so school located events are great. They are a supplement, and we are continuing to show up and be in community in many, many, many other ways, and frequently, even if that means an event vaccinates 3 people and not 300.
Great, thank you. Tiffany, anything you'd like to add?
I'd like to add that something that I said earlier, which is how important sustainability is. And so there have been experiences in these diverse communities where we've swooped in when we've had lots of grant funding and said, look at this great programming. And then when the funds run out, you leave. And so there's not a lot of discussion sometimes or thought that goes into actually making sure that you can sustain these programs, because as we know in public health, it takes a long time to influence behavior change and adoption. And so we have to, at the outset, start thinking about, okay, we've got tons of money now, but how are we going to keep this going? And so we're working with our partners to have a third-party billing solution where you can bill health insurance companies and get reimbursed. So there are a lot of folks now who say, oh, well, we have all this money, we can't bill now. Well, you can bill now so you can get some non-discretionary funding that you can, or discretionary funding that you can save for later, because this money will run out and I'm not sure that the problems will be solved. So we need to think about, how do we sustain this and how do we bake that into every part of the planning process so that folks won't blame us once again for showing up, saving the world, and then leaving.
and then leaving. Yeah, Tiffany, that's a great suggestion, and we are about out of time. But I would like, since sustainability is so important for having a lasting impact in public health, see if others would like to add to Tiffany's comment about how you're going to sustain this. So I get that you have a lot of funding now, which is helping with the COVID vaccines and hopefully with the related catch up and flu vaccines too. But Tiffany's point about building infrastructure that can be there when there's not so much emergency funding available for vaccines in a pandemic, but that could, for example, connect you more effectively to the health plans, which are required to cover all of these shots. Other ideas that you all have about sustainability, and we just have a couple of minutes. So maybe we'll go to Caitlin and Sarah next.
I think
well, my regular.
Oh, sorry, Sarah.
No, it's okay.
I went first last time. You go first.
My regular work, if we weren't in a pandemic, is around supporting school-based health centers, and that effort is really important to me. And so we'll continue to have our school-based health centers be an epicenter of routine childhood immunizations and COVID vaccine, which is now, required by their fund, which is, their funder, which is our county and city, to make sure that vaccine is included in the vaccines that they're able to provide to students. So that's one strategy that we know can be sustainable and that we're grateful for to have in our community. And as we expand our school-based health centers across our state over the next couple of years, that would be part of routine care. So that's one sustainable strategy, and other things Caitlin can comment on.
I think the big thing I would want to point out is the relationships, is that there's not really been the opportunity to build these relationships. We've had health over here and education over here, and very few opportunities where those two pieces meet. And I think this has forced those two systems together in a way that is really building human connection that is a platform for further efforts. So whether that be school-based referrals to specific pediatric providers that can provide COVID and MMR and Tdap and HPV vaccination, we're doing that. It's the school-based health centers, but it's also relationships with our emergency medical providers, with our federal pharmacy programs. Once we know that we can do it, it's a lot easier to keep doing it. And hopefully there will be funding or funding mechanisms that will allow it to sustain further. But without the relationships, it's impossible. And so this has really offered an opportunity to build and sustain relationships, even as funding adjusts.
Mm-hmm. Thanks. And Gabriella, I'm going to give you the last word on this as we wrap up.
I would definitely agree with what was just said, increasing our school-based health centers. And I think this has brought to light the importance of health. As in education, we look at Maslow's hierarchy of needs. And if we don't have that established, we quickly see what happens in the classroom. And so the increased need for us to be partners, and the increased need for us to utilize our school-based health centers and increase them, really, we've seen over the course of the pandemic, right in our face, how important it is to have successful in-person learning.
Yeah, we sure have seen that. And I really want to thank you all, not only for all your efforts on the ground to make sure we have successful in-person learning supported by effective school-based vaccination clinics, but also the time to contribute to this discussion. You all did it very efficiently. We do have a little bit of time now for a break. We're going to restart again at 1:45 Eastern time with our next panel. Look forward to seeing you all then.